So there's over 100,000 Australians living with type 1 diabetes, and they manage their lifelong condition with insulin. It's a condition where the immune system attacks the pancreas and they can't make insulin, and so rely on insulin lifelong. But insulin is imperfect. It isn't enough to control glucose levels. It can induce weight gain and cause insulin resistance. So we did this research to see if a non-insulin therapy, metformin, which is a simple tablet used in type 2 diabetes, can help to reduce insulin resistance and help glucose control in type 1 diabetes. Keeping glucose levels steady is challenging in type 1 diabetes, but it's important because it helps to reduce long-term complications such as future risk of heart attacks and stroke, kidney disease and eye disease. But it's really challenging with just insulin because of all the ups and downs every day. And that adds to the burden of living with type 1 diabetes, is all of those daily decisions and challenges with using just insulin alone. The reason why we had a look at metformin was that it's a simple tablet, it's very cheap, it costs only about $4 a month, and up to 10% of people with type 1 have been using it off-label, but there haven't been enough research done into how well it works. So we undertook a study in 40 people with type 1 diabetes and treated them with metformin for 6 months compared to placebo. And we looked at detailed measures including insulin resistance and insulin dose. What we found was that metformin did not reduce insulin resistance, which was a big surprise to us. But what we did find was that insulin dose had reduced, so people needed less insulin. And that's very important to people with type 1 diabetes who are looking to simplify their treatment. Why we're excited is that ordinarily it takes many decades and billions of dollars to develop new drugs. And metformin is one that's tried and tested, and it's been around for a long time. And we've managed to show that it's safe and effective in type 1 diabetes, giving people with type 1 more treatment options in addition to just insulin. Our ultimate goal is to find non-insulin treatment options to help people with type 1 live longer, happier, healthier lives.